If you are suffering from chronic pain, you're going to want to listen to this series because truly I believe that if you could understand why you are hurting the way you are, and by understanding this pain mechanism in your body, you can start to get relief, then I think it's worth me trying to teach you about pain. Now, I don't know if you know it, but over 50 million Americans suffer from chronic pain. And what's shocking about this is it's a problem that's not going away, and it seems like it's getting worse. Pain is the number one cause of long-term disability, and yet millions of people aren't getting real solutions. Instead, they're handed pills and injections or surgery, and none of which actually fix the root problem. So if you are struggling with chronic pain, you're not alone. And more importantly though, you don't have to remain stuck. I'm Adina, I'm a physical therapist. And one of the things that frustrates me most is the over-reliance on medication when it comes to pain. Pills they just dull the pain, but they don't heal your body. So that's why I'm making this series, to help you to understand your pain. And then I want you to start understanding how to cooperate with the body to learn to conquer it in natural ways. So this video is part one, and we're going to break down a few things. Introduction, what pain actually is, the difference between acute and chronic pain, and then how pain becomes long-term and what you can do about that. So by the end, you'll have a beginning of an understanding of what's happening in your body and how to take control. So again, let's start with the simple question. What is pain? Well, you may not believe this, but pain is not your enemy. It's actually your body's built-in system for an alarm purpose. So think of it like a smoke detector. It doesn't automatically mean that something is permanently damaged. It means that your body is warning you that something is wrong. Now, pain usually does happen though because of known things like an injury, like a strain, a fracture, or even after a surgery. But then there's also things like instability. So if the muscles surrounding a joint are weak, unstable, the body will try to compensate, and it creates spasming in other areas. Or you can get abnormal pressures through your joints that are going to create wearing down, and it's going to create pain. The other factor is inflammation. Now, this is your body's natural healing response, but sometimes this inflammation can last too long, and then it causes more harm than good. So here's something though that people don't realize, that pain is not just a physical experience. Your brain plays a major role in how pain is perceived. So sometimes even when the injury is gone, your brain keeps the pain alarm going. So this is where things can get a little tricky, and you might be in this situation if you're dealing with persistent chronic pain. So let's understand the two major types of pain. One, acute pain. Your body's natural response is your acute pain that happens immediately, usually after your injury. Like twist your ankle, you pull a muscle, but your nerves wake up and they send a message to your brain that says, hey, something's wrong here. This triggers inflammation, which is part of the healing process, and blood rushes to the area and it brings nutrition and oxygen to the tissue. Then your immune system gets to work and it starts cleaning up the damaged cells, and this is a pretty elaborate process. And then that pain that's kicking in, it's to be there to protect you, to stop from overusing that injured area. And normally, acute pain reduces in 3 to 6 months, depending on the severity of the injury. Now, chronic pain is when that alarm system gets stuck. And this is where pain becomes a problem. And it's more likely where the 50 million people are in their process. And if pain sticks around for more than 6 months, even after the injury is healed, then it's going to be classified as chronic pain. And this is frustrating because sometimes the original injury is completely healed, but the pain is continuing to send signals and like that broken alarm system. And then this is when pain is moving beyond the injury and it starts affecting your entire life. So why does pain linger long after an injury has healed? We're going to hit 3 major reasons. One is inflammation overload. Inflammation is supposed to be temporary, but if it lasts too long, it can start to cause damage instead of healing. Adrian Lowe says there's nosy neighbors. So that effect is that's like when you have pain that seems to spread from one area to another. Your brain is starting to, again, protect you, and it's recruiting other muscles to compensate for that area. And this leads to tension and stiffness in those new areas. And there's no actual damage. 3, the brain's pain memory. So the longer you experience pain, the more sensitive your nervous system becomes. So this means that even small, non-harmful movements can feel painful. So this is where people get stuck and they're feeling hopeless. But the thing is, I'm telling you that there is hope, because just like your brain has learned your pain, it can also learn how to turn off that pain. So now that we understand why pain happens, I'm going to give you 4 ways to prevent it from becoming chronic. And these are still applicable if the pain has become chronic. 1 is that you really want to move sooner, not later. And when we're in pain, the instinct is to rest and to avoid movement. But the truth is, lack of movement will make your pain worse. So gentle, controlled movement improves your circulation and helps reset those pain signals. 2, you want to reduce your inflammation naturally. Anti-inflammatory medications may help short term, but food is your best medicine. Omega-3 fatty acids, that is the specific element required to turn on your anti-inflammatory process. And so you want to make sure your nutrition includes these foods with this omega-3 fatty acids, along with leafy greens and good hydration. And this will help shut off that excessive inflammation naturally. Number 3, train your brain to stop overreacting. If you've ever had pain that spreads or becomes intense over time, again, that's because your brain is starting to misinterpret signals. And so there are a few techniques that I want to share with you to use to train your brain to stop overreacting. By using techniques like 1, deep breathing exercises with progressive relaxation. With this technique, you're starting from your feet on up, and you contract your muscles and then you relax them while breathing deeply. And so this is going to start to release the tension in your muscles. And it's going to calm down your pain, but it's also going to lower those feelings of stress that you might be feeling. Another one is 2, graded exposure therapy. And that's when you start with very, very basic movements that create minimal fear. And these can be very simple movements like moving your knee to your chest or doing a stretch or even just walking. The key is that you're wanting to break the cycle of this fear of movement. And the only way that's going to happen is by you doing the motion. And so it's important to understand that you're not going to damage anything. You're not going to hurt yourself. Okay, and if you're concerned, this is why I recommend physical therapy, to kind of give you that guidance. Okay, so these are there are some specific ways that you need to move your neck or your back, depending on if you're dealing with a disc problem or a stenosis problem. And again, that's where a physical therapist would be helpful in guiding you. But again, this is something, just start with very simple movements. A last technique is pacing, and that's helpful for really helping you to start reclaiming your life. It's helpful because it helps you to get back to doing tasks, and it might even help you with getting back to doing your job. And this is something we're going to have to talk more about, but I just want to introduce it to you. But the concept is only that you do as much of a task. Now, this is an actual task, like cleaning something in the yard, in the house, and you want to do it so it doesn't create pain. Because what happens when you feel better, you're going to be tempted to do much. And then you're going to end up flaring, and that's not a wise thing to do. And it's not just because you're going to hurt, but because it's going to strengthen that brain's connection to that pain and activity. We're going to have to talk about that more, but again, as an introduction with pacing, you're going to stop short of the pain flaring up. So for example, if you can do a task for 20 minutes and it ends up in pain, in order to apply pacing, stop the task at 10 minutes before the pain starts to flare. Leave the task, go rest, go do something else, and then come back and just do it for 10 minutes. So that's pacing. And that's what that starts to do, is raise your pain threshold, and so that you can start to gradually do more activity longer with less pain. So these are just a few techniques to start to break that cycle of misinterpreting movement and pain. Now, the last one we're going to look at is pay attention to that sleep and stress factor that we mentioned already. The stress and pain are very much so connected. But poor sleep and chronic stress both increase inflammation and pain sensitivity. So learning to manage your stress and getting quality sleep can really make a huge difference. Now, in the next video, we're going to tackle a huge question because there are some factors as to why some people are staying in pain longer. And so I want you to understand a little bit more if you're somebody dealing with a chronic pain, hypersensitive pain. And we're going to still keep talking about how do we retrain our brain so we can turn off this pain. So if this video was helpful, make sure to stay tuned for part 2. If you know someone who's struggling with pain, share this with them. I want people to learn about how to deal with their bodies, and share this. Get the word out. And make sure that you subscribe so you know that when the next video is released. So understand, your body is designed to heal. You just need the right tools. So I will see you in the next video.